A group of legislators has asked the feds to step in the ongoing dispute over Medicaid funding for more than a dozen behavioral health service providers. The Martinez administration froze payments to the group after an audit found alleged overbilling as well as accusations of fraud. News 13's Matt Grubbs is live in the Newsplex with details. Matt.
Dean, the lawmakers are concerned that because of the thousands of people who use the services through these providers, suspending payments puts an already less than robust behavioral health care system in jeopardy. Administration insists it's not so.
It is an urgent plea from a state legislative committee to the federal government. The letter sent this month to the Federal Department of Health and Human Services asks the secretary to, quote, provide the state of New Mexico with written assurances that the state's Medicaid funding will not be at risk or in peril. Lawmakers like Albuquerque State Senator Jerry Ortiz y Pino worry that with the Martinez administration's freeze of funding for more than a dozen audited providers in 9 communities around the state, the behavioral health network in New Mexico will wither on the vine.
The department's position is it's not going to cause any problems. We just bring in these Arizona managers, they take over. We get rid of these fraudulent local managers.
The democratically controlled legislative committee that the senator helps run doesn't believe that will work. From their letter, we fear that within days or weeks, New Mexico's existing and already fragile statewide behavioral health system will be the casualty of the misapplication by the HSD of these new PPACA Medicaid fraud and abuse regulations. That's referring to Obamacare. The Martinez administration disagrees, saying a management group from Arizona will get the job done without any interruption in service.
There's been broad agreement that we're following the law in response to the serious findings that approximately $36 million in funding to help those most in need was misspent and not used to properly provide behavioral health services.
We got in touch with the Department of Health and Human Services today. They say they have received the letter from lawmakers but at this point, the department doesn't have a response. Dean, back to you.
All right, Matt, thank you. The state plans to spend more than $15 million to bring in that management group from Arizona. That has drawn attention for fees that climb up to $300 an hour for some of the top executives.